Hello everyone, myself Dr. Preeti Mahawar. I am fertility specialist and I am practicing fertility for the last 7 to 8 years. IVF means in vitro fertilization. It's a type of assisted reproductive technique. It's a fertility treatment in which the eggs and the sperms, they are kept together in a laboratory, and then the embryos are made. These embryos are grown in the laboratory and then they are transferred back into the woman's uterus. People generally ask, do every couple attending the clinic needs an IVF? I will say absolutely no. A doctor consultation is required if the couple is unable to conceive after 1 year of trying, and during the history, physical examination as well as the various blood tests, we find that there are some couples who may have damaged or blocked tubes, endometriosis, anovulatory cycles, premature ovarian failure, unexplained infertility, male partner having sperm count nil or less of motility or morphology. These are the persons who will need an IVF. Around 85% of the couple will conceive within 1 year of trying without any doctor's help, and 15% will be the left. These 15% will need actually the evaluation for infertility. When they try to contact a fertility specialist, we generally undergo physical examination, clinical history taking and certain blood tests. With all these investigations, we consult the patient and plan a treatment and a time frame according to their preferences, and thus the treatment starts. When the couple is advised for IVF, they are required to come to the clinic on second day of the menstrual cycle. On this day, after the ultrasonography, the woman is advised fertility injections. These injections she continues for the next 10 to 12 days. She is monitored regularly with the help of the ultrasonography and the blood estradiol level. During the scan, when we find that follicles have reached a mature size, a trigger injection is given, and after 35 hours, the ovum pickup is planned. Ovum pickup is a minor surgical procedure in which general anesthesia is given and the woman is required to come on the empty stomach. After aspirating the follicles, these are handed over to the embryologist. The woman can go home on this very same day. On the day of the ovum pickup, the husband also gives his semen sample. The retrieved oocytes are then placed in a culture dish and mixed with the husband's semen. If we find that the sperms are surgically retrieved with the help of a process called TISA, or if the sperm motility, morphology or count is less, in that case a process which is called ICSI is performed. ICSI is intracytoplasmic sperm injection. The fertilization is observed after 16 to 18 hours. These embryos are then monitored in the laboratory in respect to the number of embryos, the cell division, the fragmentation or the vacuoles. The embryos can be transferred on either day 3 or day 5. A day 5 embryo is called a blastocyst. In case of the fresh transfer, the woman is called on day 5 and the fresh transfer, the breast looking embryos are transferred to her and the rest of the embryos are frozen. Embryo transfer is again a very short process. Anesthesia is not required. She is asked to lie down in a lithotomy position with a full bladder. The embryologist loads the embryos in a catheter, and with the help of an ultrasonography, these embryos are gently put inside the woman's uterus. Then she lies for around 15 to 20 minutes. She is given a set of instructions and medications which she follows for the next 15 days. After the 15 days, she is called for a blood test which is called the beta HCG to find out whether the pregnancy or implantation has taken place. If the pregnancy test is positive, she is asked to continue her medicines and then call for a scan which is to check for the gestational sac. If we find the pregnancy is negative, she again called for counseling and prepared for the embryo transfer with the embryos which are frozen in the laboratory. Success rate of IVF is generally 40%. It depends upon the age of the couple, the quality and the quantity of the eggs, the quality and the quantity of the sperm, what factors they have been suffering from, how long is the infertility. But in general, younger the age of the couple, more is the chances to conceive. During ovarian stimulation, women can have a bloating sensation, heaviness in the chest, a little bit of nausea and vomiting. After the ovum pickup, she can have a little bit of bleeding, spotting and mild cramps in her abdomen, but these are generally the minor side effect. After the pregnancy happens, she can suffer from miscarriage, which is same as in the natural pregnancy. There may be the chance of ectopic pregnancy in which the embryos implants at a faulty position. If 2 or more embryos implant, there is a risk of multiple pregnancy. In case there are no healthy eggs, no healthy sperm or no healthy embryos are formed, in that case the couple is called for a detailed discussion what can be the reason be. They may call for another IVF or they may opt for donor eggs, donor sperm or donor embryos also. Well, I just want to say that the basic feeling that woman cannot be mother is a very stressful indeed. Infertility is growing day by day, but IVF is not painful at all because the injections are not painful, because they are subcutaneous injections. The ultrasonography is not painful. Ovum pickup is done under general anesthesia. So I can say that IVF is not a painful process. There is no need to take the stress because the cases of the IVF which are selected, the chances of natural conception is almost nil, where with the help of an IVF the chances increase to around 40 to 50%. What is basically required is few counseling sessions before starting the journey of the IVF to remove any questions or doubt in the couple's mind. The couple can improve their chances by stop smoking, quitting alcohol, by keeping their weight and the normal BMI, increasing lot of fruits and vegetables in their diet, sleeping minimum 8 to 9 hours, avoid late night parties, following the doctor's instructions carefully and keeping yours and your partners in a positive frame of mind. Yes, there are other benefits of the IVF too. IVF is an advanced technique which helps in couple conceive even in the critical cases. In case of fertility preservation, a woman can opt for egg freezing now and opt for childbearing later. In case there are some genetic diseases which runs in the family and there is a chances that it can be transmitted to the offspring, we can offer them pre-implantation genetic testing. Even in case of the premature ovarian failure or in case of azoospermia where the sperm count is nil or the motility and morphology of the sperm is very poor, even they can dream of becoming a father and mother. So I would like to say that IVF is very beneficial.